Lumbar vertebrae are the largest vertebrae. The body is thicker than that of the cervical vertebrae and thicker than that of the thoracic vertebrae. It's a big, chunky body. The spinous processes are short and project posteriorly. The transverse processes are slender and project laterally, and the vertebral foramen is triangular. So fine. What do you need to identify a single lumbar vertebrae? Again, this is something that you do on a lab exam. Well, really just the chunky, thick body and the short, stumpy spinous process is enough to help you identify a lumbar vertebrae. The spinous processes are attachment points for the lower back muscles that control the lumbar curvature. Okay, so clinical correlation, compression fractures. The lumbar vertebrae bear most of the weight of all of the vertebrae of the whole body. They are the most likely to have compression, sometimes called wedge fractures. And here we have a picture showing you a normal vertebral column with the anterior bodies stacked one upon each other. And then here there has been a compression fracture. And they call it a wedge fracture because the vertebra that's affected starts to have more of a wedge shape and less of a square boxy shape, okay? If you're looking at this on like a simple x-ray, for example, and have a wedge appearance of the vertebrae because of the compression fracture. As if that wasn't bad enough. Another clinical correlation, the intervertebral discs between the lumbar vertebrae are also the most likely to rupture. In a rupture, the annulus fibrosus of the intervertebral disc can tear, and the nucleus pulposus may then bulge outwards. The nucleus pulposa then compresses the adjacent spinal nerves, causing pain and injury. And that's shown. There's a normal intervertebral disc on the left and an intervertebral disc in which the annulus fibrosus has ruptured and the nucleus pulposus has come out and pressed on a spinal nerve that is coming out one of those intervertebral foramen we talked about, and it's getting squeezed, and now the area that it's going to may have neurological deficits, and this will be painful, and this is what happens. The sacrum and coccyx, and we're done with the vertebral column. Okay, the sacrum consists of 5 vertebrae that begin fusing shortly after puberty and are completely fused between age 25 and 30. The sacrum is curved with a convex posterior surface. In other words, it curves out. And we all know that your bum curves out. The sacral canal, a continuation of the vertebral canal, extends the length of the sacrum. The end of the sacral canal is covered by connective tissue. The sacral foramina, or holes in the sacrum, are similar in location and function to the intervertebral foramen. Spinal nerves come out of the sacral foramina. The auricular surfaces of the sacrum articulate with the ilium of the hip bones at the 2 sacroiliac joints. The auricular surfaces of the sacrum articulate with the ilium of the hip bones at the 2 sacroiliac joints. The sacrum is an attachment site for multiple muscles, including the lower back, hip, and thigh muscles. The sacrum protects reproductive and digestive organs. The coccyx consists of 3 to 5, usually 4 small vertebrae. The vertebrae begin fusing by age 26 and may not complete their fusion until late in adulthood. Complete fusion may not occur in some adults. However, in very elderly people, sometimes not only the coccyx vertebrae fuse, but the coccyx fuses with the sacrum, just, further adding to the decreased mobility of elderly people. The female coccyx points more inferiorly and the male coccyx points more anteriorly. The position of the female coccyx has evolved for childbirth. The coccyx is an attachment site for a number of ligaments and for a muscle that constricts the anal opening. Now, if you look here, here's the female pelvis, and when we learn about the female pelvis in the appendicular skeletal section, we'll learn about a lot of features that are different in the female pelvis versus the male pelvis. But right now you can see that there's a bit more of an inferior pointing of the coccyx versus a bit more of an anterior pointing of the male coccyx. Why does that mean that the position of the female coccyx has evolved for childbirth? Well, you don't want any bones in the way of the opening in the pelvis that the baby's head has to go through. You want the opening to be as big as it can be so that baby can get out. As it is, it's a very tight fit. I can say that from experience, okay? So, I was an obstetrician, so it's a very tight fit, and any little bit helps. So that's a difference there between the female and the male pelvis. Okay, the ribs. We have left the vertebral column, ladies and gentlemen, and we are on to the ribs. That will be followed by the sternum. So the ribs. The rib cage includes the thoracic vertebrae, the ribs, and the sternum. Altogether, there are 12 pairs of ribs. The ribs are flat bones that wrap around the body. They angle slightly downwards from the front to the back. So the rib cage, okay, is including thoracic vertebrae, the ribs, and the sternum. And then you have your barrel-shaped thoracic cage or rib cage. Okay, 12 pairs of ribs. You can count them out. It's nice to do every once in a while. They're numbered in both pictures. And we can see that they're flat bones, and we can see that they angle slightly downwards from the back to the front. And this is a very important feature of the rib cage that we will learn about in depth during the respiratory system, because the mechanism of inspiration involves a lifting of the anterior part of the ribs, okay? So that the ribs go from being less on a slant downwards in a relaxed position to more of a straight across position during a full deep inspiration. We'll learn about it, all in good time. All right, so the ribs, they're attached to the vertebrae posteriorly and to the sternum anteriorly. 10 of the 12 pairs of ribs are attached to the sternum by costal cartilages. The costal cartilages are composed of hyaline cartilage, and they're strong but flexible. And it's the costal cartilages that give the rib cage flexibility. Right? Just imagine if there was only a bone-to-bone joint from the vertebrae to the ribs, and in the front there was a bone-to-bone joint from the ribs to the sternum. We'd have a fixed size and position of the rib cage. But the costal cartilages step in and give the rib cage flexibility. All right, there's 7 pairs of ribs that attach directly to the sternum by separate costal cartilages, and these are called true ribs. Ribs 8, 9, and 10 have costal cartilages that fuse before connecting to the sternum, and therefore 8, 9, and 10 are called false ribs. False ribs. Ribs 11, and 12 are not connected to the sternum by costal cartilages at all. They are only connected to thoracic vertebrae, and they are called floating ribs. The rib cage protects the organs in the thoracic and upper abdominal cavities. The ribs are attachment sites for muscles involved with breathing, and they maintain the position of the vertebral column. And the muscles are attachment sites for the ribs are attachment sites for muscles involved with breathing, maintaining the position of the vertebral column, and moving the clavicle, scapula, and upper limbs. The sternum. The sternum is composed of 3 bones, the manubrium, the body, and the xiphoid process. The 3 bones fuse by age 25. And if we look at our picture and we imagine that we're wearing a tie, the manubrium is the knot, and the body and the xiphoid process are the dangling bit of the tie below. The manubrium articulates with the clavicles and the costal cartilages of the first pair of ribs. We'll learn about the clavicles in the next lecture. The body articulates directly with ribs 2 to 7 and indirectly with ribs 8 to 10. The xiphoid process is an important attachment site for the diaphragm, which is an extremely important muscle, and the rectus abdominis muscle. The sternum protects the mediastinum and the heart. And remember the mediastinum from lecture 1. It not only has the heart in it, it also has the aorta and the superior vena cava, the trachea, the esophagus, and other structures. So On that note, with the sternum protecting the heart, we will finish. We will have a nice lab to look forward to, in which you can find the bones and their features, and it's enjoyable. And then the rest of the lecture slides here are truly many additional practice questions that you can do if you have time, perhaps before the lecture and lab exam as a review. All right, stop share and